Hello, and welcome to the Softheon Policy Pulse Update. I'm Josh Schultz, Head of Government Affairs at Softheon. In my role, I translate complex policy and regulatory changes into clear implications for the people and organizations who rely on the ACA Marketplace coverage. Today, I'm going to be discussing the CMS Marketplace Integrity Rule, the recent decision by a federal court that paused some of it, the appeal related to that, and what this all means for issuers and enrollees as we're heading into the 2026 open enrollment period. The Integrity Rule, as it's called, was finalized in June and intended to strengthen standards in the ACA marketplaces. It included a $5 surcharge for certain people who don't go back to the exchange and update their information and just get a plan automatically, stricter verification for people who enroll outside of open enrollment during a special enrollment period, new documentation requirements for some low-income applicants in order for them to get subsidies, and a one-year cutoff if subsidies in the case of somebody who didn't reconcile what they were paying for their plan and their subsidies with the IRS. Finally, and this is really important because it speaks to the lawsuit and how it has evolved, the rule expanded what's called the actuarial value ranges, giving insurers more flexibility in plan design, and those plans have been submitted. For everyone, and especially insurers, this meant new compliance steps and system changes on a pretty short timeline. And for consumers, it could have added paperwork, higher costs for premiums, and even the loss of subsidies in some cases. But on August 22nd, a federal judge stayed or put a pause on 7 provisions of the Integrity Rule around the country, nationwide applying, finding that some went beyond what the ACA allows and others lacked enough supporting evidence to implement. This means that most of the rules changes will not take effect for 2026. In response, the U.S. Department of Justice has appealed, but it's focusing on the actuarial value, the plan design provision only, since many issuers already filed 2026 plans using the new ranges permitted in the rule. Rolling those back could force plan redesigns, repricing, and other aspects of other things at the last minute. The appeals court will decide whether those new plans can move forward or whether plans, as I'm about to speak to, will need to be refiled by insurers. So for issuers, the big concern is timing. CMS has given a special September 30th through October 1st window to refile plans if needed, depending on how the court rules. And final rate approvals are being held until later in September. This compresses work that normally takes months into a matter of weeks. For consumers, though, the outlook from the way that this lawsuit has evolved is stability. There won't be a new $5 surcharge on plans for people who auto re-enroll. There won't be across-the-board documentation required to enroll outside of open enrollment during special enrollment. And there won't be subsidy cutoffs at all related to tax filing. Those are blocked. Finally, and we didn't mention this earlier, there won't be coverage rejections by insurers over unpaid premiums, past unpaid premiums to a particular insurer. Insurers won't be able to reject enrollees for that reason. So open enrollment 2026 for the consumer should feel pretty similar. Aside from the prices of the plans, with the only open question being the flexibility for insurers to design the plans the way that they intended to this cycle. So the takeaway is clear. Issuers face pressure to adjust quickly, consumers can expect some continuity, and the courts will determine how much of the Integrity Rule survives into future years. Thanks for joining me on the Softheon Policy Pulse Update. I'll be back soon with more updates.